Hello there, my name is David Burlicue, and this is going to be our disease presentation. I am doing hepatitis B, serum hepatitis, and my partner is going to be doing ringworm and the types. So to start, HBV is going to be a viral DNA disease. Its causal agent is going to be HBV, hepatitis B virus. It's going to come from the HepaDNA virus family and the orthoHepaDNA virus genus. Its morphology can be identified through patient blood samples. Electron micrographs are used to identify viral fragments, intact virions, which are called Dane particles, and other antibodies. These qualities can help us identify the morphology of this very small virus. So small, in fact, it's 42 nanometers in diameter. It's going to be spherical and enveloped. The motility does not apply in this case. So, the systems and signs and symptoms. Like other hepatitis viruses, the liver is going to be affected, just like hepatitis B. Specifically, necrosis of hepatocyte liver cells, which the liver is mainly composed of. So, then moving on to signs and symptoms. Good news is, most of the people who contract HBV are going to be asymptomatic, and the chance for immunity and complete liver regeneration is highly likely. So, if you do happen to experience signs and symptoms, they're usually going to come in the form of malaise, fever, low white blood cell count, chills, anorexia, abdominal discomfort, dark urine. In some cases, rashes, arthritis, and jaundice can occur. And in other cases as well, enlargement of the liver and tenderness can occur. So, this virus, due to its persistence and oncogenicity, which is the ability to grow tumors in the tissues over time, this can cause serious secondary signs and symptoms and complications. A very dangerous one is going to be the high risk of chronic liver disease. Although very few cases get it, getting chronic liver disease poses a 200 times more risk for hepatocellular carcinoma, liver cancer. So, this means that getting it at an early age increases the chance of that even more. That's why it's important to vaccinate children to prevent the contraction of HBV. In diagnosis, differential diagnosis can be tough considering other hepatitis cause liver damage as well. So the signs and symptoms can be challenging to identify. However, we have tests, and we can use these tests to detect it at an early point. These tests include indirect and direct ELISA and radioimmunoassay tests. These tests allow for the detection of patient antibodies and HBV surface antigens. Also, since vertical transmission from mom to baby is very likely with HBV, diagnosis and testing of the mother is recommended prior to pregnancy. Also, some useful information to support diagnosis is patient history. Even though differential diagnosis is a challenge, you can ask your patient some of these questions. Are you involved in recreational drug use, especially needles? Are you sexually active? If so, how many partners? Things like that can get a good idea of their behaviors. Also, travel history, very important. HBV is popular in tropical places, parts of Africa, Asia, South America, and the Caribbean, as the CDC says. So, moving on, we have prevention and treatment. Good news, we have a vaccine for HBV. Although it doesn't completely cure it, it is very helpful in preventing the transmission of HBV. We have vaccines such as Recombavax and Energix. These are powerful vaccines that involve pure surface antigens that are cloned in yeast, given to you over an 18-month period. 3 doses, booster shots are also recommended. However, if someone is allergic to yeast, good news, we have Hepatavax, which is sterilized carrier blood antigens instead of the previous. So, and more good news, vaccines allow for 90% effectiveness in the prevention of HBV. Vaccination at an early age is crucial since transmission of this virus can come in various ways, like toothbrush, communal areas, bodily fluids, a lot of ways, you know? So, people like medical workers, students, transfusion patients, and immunodeficient people are highly recommended to get vaccinated to prevent this. Also, universal precautions without the vaccine include using protection during intercourse, not having so many sexual partners, abstaining from recreational drug use that involve specifically needles, specifically contaminated needles. And these are all good ways to prevent the contraction of HPV. However, if you have been punctured by a contaminated needle, hepatitis B immune globulin is very helpful in preventing transmission as well. Treatment, we have interferons, more specifically recombinant interferons. These are going to stop replication of this virus and liver damage in up to 60% of patients. Also, another treatment is just simply system management, since this virus is going to be going on. So, anything else? Well, as you can see by these pictures, hepatitis B can be a very scary disease. What makes it quite dangerous, though, is the way it can be transmitted in so many ways. It can be transmitted vertically, mom to baby. It can be transmitted through STDs, semen and vaginal fluid. It can be transmitted through contaminated needles, maybe barbering, and toothbrushes even, in tight communal areas. Bodily fluids such as saliva. This makes hepatitis B a pretty risky virus to be transmitted. And it gives good reason to be careful around communal areas and who you choose to be sexual partners with. And also, hepatitis B, finally, can last in a serum for months. So, some of these pictures provide examples of what hepatitis B can do to you. It can cause jaundice, which is the yellowing of the skin and eyes. It can give you some pretty nasty rashes. Again, normal symptoms, abdominal discomfort, and nausea. And then, specifically, necrosis of the liver. It is going to damage your liver. It is not a good disease to get. Be careful, listen to the CDC and their prevention and treatments, and this is going to cover HPV. Thank you.
Ringworm! The most annoying dermatophyte ever. Okay, so fun fact. Despite the name, ringworm is not actually a worm. It's a fungus, though it can be caused by one of 3 genuses, which are so similar that it's not really even worth, disseminating the differences. There's 39 families in all. You'll see that in the next slide. So it can either be a variation of tryptophycin, mycosporum, and epidophyton fungi, which, is in the name of a dermaphyte. Think about ringworm is that it usually comes in the form of a red ring of skin around a rash that's really itchy and it's really awful to deal with. You'll see pictures of that too. Dermaphytes love to eat keratin, which is unfortunate because that comprises our skin, our nails, and our hair. So they love to stick around things that are living, like you and these. But the reason that they're so good at what they do is because they're non-inflammatory. And by the time they get into the little dermal abrasions that they love to stick on and stay there and multiply, it's already too late because they're so far spread that they keep on eating through the dead layer of flesh, move on to the next one, dead layer of flesh, move on to the next one. They're not life-threatening, but they're itchy, they're painful, and they're ugly. So, in total, there are these 3 genuses, 39 families in all. Tryptophycin usually causes ones that are on the scalp, the body, beard, nails, and have acne slip, which is a lovely thing that gets in between your toes. Mycosporum usually hangs on your scalp and your skin. Epidophyton are usually on the groin and in your nails. So here's the different types of ringworm. There are some really grody pictures up ahead, so if you have a weak stomach, be careful of that. Tinea capitis. This is the one that gets on your head and in your eyebrows and your eyelashes. It mostly focuses on the hair areas that are on the top of your head. It's very common in children because children are gross and they love to touch each other. They come through direct contact, which is how most ringworm cases form. The appearance differs, so sometimes it'll come in the form of red rings, like this, or they'll come in gray patches. Sometimes there's a severe inflammatory reaction called carrion that comes in these ugly little bump things that are really painful, and they have like scab-like qualities. Not treating this one could result in loss of hair and damage to your hair follicles, which means your hair will never grow back there again. Tinea barbae, basically the same thing as tinea capitis, but instead of being on the top of your head, it's on the bottom part of your head where the chin is and your beard is and whatever else you have there is. It's called barber's itch for a reason, because there used to be a lot of cases back when barber practices were a lot more unhygienic. Nowadays, it's mostly just coming from animals. You touch an animal, then you touch your face, and then, oh, there's ringworm. Tinea corpus. It's an invasion of all smooth skin you have on your body, anything that's exposed. This is the most common form of ringworm, and it comes from contact with humans, animals, soil, anywhere the fungus happens to be hanging out. It usually comes in the most common, the most recognizable form of ringworm, which is a big old scab, big old ring of rash, smacked right there on your body. It itches. It's got a red ring, ringworm. So these vary pretty heavily in appearance and severity. The lesions either have a little bit of diffusion to a lot of diffusion, and they're either just kind of an ew to a pustular ew. Though it depends on the health of the patient, the hygiene, and what exactly caused it in the first place. Tinea cruis. This is jockstrap, or jock's itch, excuse me, in more colloquial terms. So it's the invasion of this part of your body right between your thighs and underneath your stomach. It's the groin region. Sometimes it gets on your genitalia, mostly the penis, because it's the most exposed piece of skin on a man's body or assigned male at birth. Loves moisture, loves heat, which is the perfect place to be if you're an athlete or somebody who is in a really laborious job. They love to survive on fomites and spread via direct contact with a human or fomite to those general areas. And it's extremely common among people who live in very close situations. Tinea pedis. Here it is, athlete's foot, or jungle rot if you live in a more tropical area. These are rarely seen in barefoot cultures because, again, they love humidity, they love heat, so a shoe is the perfect environment for them where they can get in between your toes and go, ho, 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 I'm going to stay here for a while. They're super duper hazard in shower floors, on socks that have been worn by people who have athlete's foot, and they have these lovely little blisters that sew in between your toes. They crust over and then they burst, and they potentially spread to the rest of your foot via this method of pustule. Tinea manum. This is kind of like athlete's foot but on your hand, because it's usually connected to the foot anyways. Lesions occur between your fingers, on the palms of your hands, on like the backs of your fingers, and they either just kind of patch up like you see here with my eczema, or they get really, really bad and start cutting deep. Tinea unguium. This is just the invasion of your finger and toenails specifically, which is just masses of infected keratin that are constantly being eaten over and over and over again, and that's why you see these superficial white patches that are thick on the nail bed, and then they become more distorted and darkened because of all the fungi that are attacking the area and eating it up. Unfortunately, thanks to artificial nails trapping in bacteria on the nail itself, this is becoming more prevalent, much like our lovely athlete's foot and shoe cause. You don't want that. What do? First and foremost, you have to recognize that you have ringworm in the first place. You can usually figure out that it's ringworm if you don't already know by the fact that it's, a ring and it's gross, by looking at it underneath a microscope. In tinea capitis, UV light will show that your hair follicles are starting to fluoresce, and that's bad because that's the fungi. Any samples that you can get from an infected area treated with heated potassium hydroxide will show thin, branching fungal growths. And culturing on selective media can help differentiate based on what you're dealing with. In terms of treatment, there's really nothing you can do except for halt growth, which keeps it on that dead layer of skin you've already got, and wait for the skin to slough off so it can die alone in a trash bin. Sometimes there are treatments that are helping your skin slough off a little bit faster, which means that the fungi can't multiply as fast as your skin is coming off. You can also combine this with gentle debridement of the skin and UV light, which helps zap it up. Most of the time, though, you just get prescribed a fungal cream. Other than that, here's my giant list of works cited. Thank you very much for enjoying our presentation.